Gynaecomastia is a condition where men develop breast tissue. It can be true gynecomastia, which is the development of the breast gland, or it can be a development of fatty breast tissue, which is actually called pseudogynecomastia. And frequently, it's a combination of both. The causes of gynecomastia are varied. The development of the breast gland in men can be normal, and there are 3 age groups in which this can occur, usually at birth, or at puberty, or in old age. In addition to this, gynecomastia can be caused by medications, kidney disease, liver disease, as well as some illicit or over-the-counter drugs. However, it's important to remember that in about 50% of cases, no cause for the gynecomastia is found. The treatment of gynecomastia depends on the type of gynecomastia it is and the underlying cause. So if it's true gynecomastia, then the treatment depends on addressing the underlying cause. So for example, if it's medication causing that, then switching to an alternative medication. If that fails, or if that's not possible, then it may be worth considering the off-license use of certain medications like tamoxifen. However, I would say the most effective way of treating true gynecomastia is through surgery. If it is pseudogynecomastia, that is fatty breast tissue without a gland, then the treatment may simply be diet and exercise, or frequently surgery, which commonly is liposuction. The surgery for gynecomastia depends largely on what the underlying issue is. So if it is true gynecomastia and there is a breast gland or a breast lump, then surgery involves simply excising this. And this involves a scar just either around the nipple or on the side of the chest wall. If the gynecomastia is actually made up of fatty tissue and is more correctly called pseudogynecomastia, then the surgery involves liposuction. In this case, I favor the use of vasoliposuction because that causes less bruising and also produces some skin tightening some months down the line. Frequently, it's a combination of both, gland and fatty tissue, so both techniques need to be used. In a small proportion of cases, there is also an excess amount of skin which needs to be excised. In my practice, I have developed a technique called the VAGS procedure, which stands for Vasa, Gland and Skin. It helps us to think about the 3 steps that are needed in addressing gynecomastia. So firstly, patients undergo vasoliposuction, which allows removal of the fat. Then, in the same operation, I make a cut either around the nipple or at the side of the chest wall to remove the gland. Thereafter, the patients are allowed to recover, and if necessary, after a period of 10 to 12 months, they may undergo skin excision to remove loose skin, though, in my experience, most patients don't need this. The chances of recurrence from gynecomastia are low unless the precipitating factor is still present. So for example, if the gynecomastia is as a result of the patient taking a particular medication and they are still taking it, then the chances of it coming back is a little bit higher. The recovery from gynecomastia surgery is fairly quick. Gynecomastia surgery is done as a day case procedure under either a general anesthetic or even under sedation. Once the procedure is over, the patient wears a compression garment for 3 weeks. All the sutures are dissolvable and there are no drains. Patients go home with some simple painkillers like paracetamol and ibuprofen and are advised to avoid undertaking any heavy lifting or going to the gym for a couple of weeks. Most patients are back at work in about 3 or 4 days and can drive after about 5 to 7 days, as long as they can do an emergency stop safely. The dressings are removed at 2 weeks, and thereafter the patient builds up their activity, returning back to full range of normal activity between 4 to 6 weeks. Results take a little bit longer, as the swelling can take a few months to settle down.